Hello, my name is Dr. Jeff Aberle, and in this video I want to discuss ABC endonasal cranial correction. So if you have distortions in your face, like one eye is lower than the other, or your nose is crooked, or you have TMJ, or you have headaches, or you have a distorted face where the top of your teeth and your eyes don't line up, where one side of your face is more squished than the other side, those types of things, you might be interested in watching this video. So what ABC endonasal cranial correction is manipulating the bones of the face using a small balloon. So what the procedure is like is you just stick a balloon apparatus down into the nose, and then you inflate the balloon, and then you release the pressure, and then you take it out again. And what this does is it ends up opening up the skull from the inside out. So in human beings, we don't have any muscles on our face that can pull bones out. And if you did, they'd be sticking out of your face, and it would look really weird, and you would actually grab them and just pull. Now, granted, then you could do it on your own, which would be nice, but it would be a very strange look. So since we don't have that, we have to do it internally, and it's not like you can stick your finger way up in these spots here. You can't get to it. They're just too small for a small finger to get into, and then pull things out. So a balloon apparatus like this is perfect for the job because it fits in very easily to even the smallest of spaces, and then when you do the inflation, it pushes the bones out in exactly the way you need it done. So ABC Advanced Biostructural Correction Endonasal Cranial Correction has developed a method to figure out which openings you need to do the balloon inflation in. And so that's a very nice thing, so you don't have to do all 6 of them, okay? Because if you look at the anatomy here, we have a bone here called the vomer bone, and then from that extends the cartilage of the nose. And everyone's felt that. I mean, if you just feel the base of your nose, you'll feel that cartilage in the middle of it because it's movable. And so that extends off the vomer here. And if you have a deviated septum, by the way, this could actually help with that too. So if you're considering surgery or something of that nature, something more intensive, you might want to just give this a try first and see if it works. But back to the anatomy here, if you look here, there's these things that stick out down here, and these are called turbinates. So you have an inferior, a middle, and a superior turbinate, and then there's spaces made here as well. So this space here, these are called concha. And so there's inferior, middle, and superior concha, and you have that on both sides. So you have a total of 6 different places where you can insert the balloon and do the inflation. And like I say, you don't have to do all 6. There's a test to figure out which one's needed that day. Now I do also want to make it clear that even though you might have nose problems, it might not be the nose that needs to be treated. You can have all kinds of other parts of the body that can cause headaches and TMJ and nose problems as well. For example, I've done the first rib maneuver on many of people, that little punch on the collarbone thing. And the moment you do that, within seconds they can breathe through their nose again, and they're like amazed by that. So other structural problems can cause tension and twists in the skull that then give you your symptoms where it might seem like you need this, but it might be another body problem as well. There could be a low back, out of place in directions your body can't self-correct, or a meningeal adhesion somewhere in the body, and you go do that, and all of a sudden the face looks better, you get more blood flow, you can breathe better, and some of these other issues like headaches and TMJ and stuff can go away. So again, it's part of the endonasal is part of advanced biostructural correction, which is the full body treatment protocol. This is a small part of it called endonasal. But this is what I'm doing the video on, and there's other videos that we have that describe the other stuff. Now, please don't try this at home. I'm doing just a little demonstration here to show kind of how this works and how you would have it done in your practitioner's office. And we need testimonials on this because this is absolutely amazing. So if you've had this done and you see a really big benefit to it, take a video, post it online, or have your practitioner do it and post it online. I had a lady one time that she wasn't able to breathe out of her nose for several years. She wasn't able to blow anything out of her nose. And one time, plus her nose was also crooked. And I do this one time on her and her nose straightens out. She was very, very excited about that because that's a look thing. But then she was able to breathe out of her nose and she was able to blow her nose for the first time, I think, in over a year. So it can have very powerful impacts. I had another lady that had completely lost her sense of taste and sense of smell. I mean, imagine not being able to smell food or taste food. In 2 sessions, and all that was restored for her. The first one didn't quite get everything, but the second one did. And so she had all that stuff restored, and absolutely amazing. Now, where else are you going to see that? You know, you lost your taste of smell, and what else are you going to do? And along you stick a little balloon in the nose and inflate it, and all of a sudden you get to taste your taste back and your sense of smell. It's crazy. But when these cranial bones get distorted and your body can't fix that, it can really affect how the nerves function, and all the different sensations that you can have in your body can change in ways that you don't want them to change. And so you restore normal function by doing this or doing another part of ABC, and you really get your life back. So people that have problems for years or decades can sometimes see big changes just with a few treatments of either this or the entire ABC protocol. So anyway, if you have any questions, please leave them on the YouTube channel, and I'll do my best to answer them. The list of symptoms is long, so we'll be displaying it here at the end of the video. But again, this is a demonstration of ABC endonasal cranial correction, and I'm Dr. Jeff Aberle, and thanks for watching.